In a country with less than 5% health insurance penetration, healthcare financing is integral to the Universal Healthcare Discourse. In attendance was Sabina Chege, the women representative Murang'a County, who, while speaking to the press, stated that the meeting had brought together the various stakeholders in the health sector to discuss the measures to be taken to ensure universal healthcare is attained, as well as to pledge their continued commitment and support to the ministry to achieve its goal of making healthcare affordable to its citizens.
In order to achieve HC, we must work together and move together as a team. There were various issues that have been raised. There were 5 points that were raised by the PS of Health. But basically, it's a commitment from each and every sector, from the private sector, from the legislatures, from the Ministry of Health, and also from the global partners that are currently in Kenya. But part of maybe what I picked is that we need commitment. We need to start looking at the way we compete to deliver service delivery to the health sector rather than competing for resources.
She continued to urge the county governments to allocate 15% of their county budgets to the healthcare sector and to stop using the money given for the healthcare sector by the government for other non-health related programs.
My priority and the committee priority is reinforcing the resources that we currently have. Currently, the money that we give to the counties don't have a specific percentage that they give to the healthcare. And taking in mind that health is devolved, all counties should at least have 15% of their allocation going to health. That is not happening. Actually, we don't have any of the county allocating a specific amount. I think just do it haphazardly. Secondly, the money that comes from the national government, like through NHIF, through the Linda Mama programs, it is put in a common county account. And so what happens, it depends on what is the governor would find fit for that money to be used. A lot of that money is being used for roads and other things and not reinvested back in health. So we are saying the money that is coming from the health sector, be it from the national government and even what is collected within the hospitals and dispensaries or the health centers, that money should be reinvested back to health.
According to Dr. Nduku Kilonzo, the Executive Director of the National AIDS Control Council of Kenya, it is important for the resources used to be locally sourced because as a country we need to be certain that our healthcare is guaranteed.
In the current space of development assistance, it is very uncertain and there isn't really clarity on how far the resources will go, how long they will last, how much of it will last, and so we really must plan, not recognizing that those resources are neither guaranteed and we don't know for how long. And so that is one of the other reasons why it is so important. And really, I think it's also about recognizing that we are moving from being a lower middle-income country into a middle-income country, and which also has implications, more or less development assistance. We have more needs for health. We have more young people who are entering healthcare. So all of those things fundamentally mean that we must think about sustainability and availability of resources in the long term.
Speaking to Dr. Walter Ombita, the Director, Kenya Healthcare Federation, he was quick to point out the role of the private sector in financing healthcare.
There are many avenues that the private sector would finance healthcare. One is through insurance, so payment of premiums, and you're able to provide those who have covered with healthcare. There's reimbursement of services offered by healthcare providers through insurers. So you'll have, once a service is offered at the healthcare facility, then the private insurers can be able to pay for the services either through capitation or through fee-for-service or through packaged finance options. There is the avenue from the supply side where you have private sector owning healthcare facilities and they are able to directly finance the business and be able to offer the service to the people who come and access care. So there's both sides, from the demand side and the supply side, that the government, but the private sector does finance healthcare.
For the country to attain universal healthcare and to safeguard it, there is need to increase domestic resources as a way to mitigate against global financing transitions and uncertainties of development assistance. For Brand Plus TV Business News, I am Daisy Wambua.